DMH NewsLink, your trusted source for the latest in healthcare news.
DMH NewsLink.
Welcome to DMH NewsLink. I'm Michaela Hunt. There is a good chance that during our lifetimes we're going to have to go to the emergency room. So we wanted to bring Dr. Ted Clark in today to talk to us about all the options that we have out there when it comes to treatment. So thank you for being here. You're the medical director here at DMH.
My pleasure.
Of the emergency center. So let's talk a little bit about this. We have the emergency room, we have express care, and the ability to call 911. Which one should we pick?
Sure. We want to focus for the emergency department, particularly on the high-level issues. Heart attacks, strokes, sepsis, severe trauma. We see all of those in the emergency department very frequently. And for 911 in particular, you want your most time-sensitive diagnoses. If you have any stroke symptoms, you definitely want to call 911 immediately. If you have heart attack symptoms, chest pain, shortness of breath, you definitely want to call 911 immediately. As for Dmh Express Care, that's typically going to be on the lower end of the acuity spectrum. This is going to be respiratory symptoms, sometimes minor lacerations, things that can be repaired at the bedside, sometimes sprains, strains, and that sort.
Let me ask you about broken limbs. Can those be repaired at Express Care?
And yes, in general, if you've got an injury and you think you might have a broken bone, but you can still walk on it, the pain's not too bad, and you want to get an x-ray, I think Dmh Express Care is a great option for that. However, if you have deformity, severe pain, can't walk, I think the ER is your best bet.
What conditions do you sometimes see in the ER that could be treated elsewhere?
Sure, particularly during cold and flu season, we'll see a lot of respiratory symptoms, runny nose, cough, congestion, that sort of stuff. Oftentimes, especially if there's no fever, that can be treated either in the outpatient setting. You can go to the Dmh Express Care, or you can call your primary care provider and set an appointment.
Unfortunately, sometimes we can be a little impatient, so it's good to know what we're facing when it comes to wait times inside an emergency room. What can you tell us about wait times and what they should look like?
Sure. DMH Emergency Department, like most other emergency departments, has a triage process. When someone comes in the front door, they're seen immediately by a healthcare provider that assesses their chief complaint and their vital signs. And from that, we're able to give them a triage level. So in general, people are seen in the order that they show up. However, there is some reshuffling that's done based on the acuity of the complaint.
Got it. And you know, we're hustling out the door sometimes and we're dealing with some of these conditions, obviously. What are the things that would be really great if we could bring them with us that would help you as a doctor?
Certainly an updated medication list. We do have electronic health records, but sometimes it helps to have information from the patient as well. A list of current diagnoses is also helpful. It may be helpful during high wait times to have something to read, and also an ID and insurance information.
Okay, Dr. Ted Clark, thank you for being here with us
My
today.
pleasure.
Appreciate it. And for more information, go to dmhcares.com/news.